Hello once again, Gary Gasalti here. Today is April 5th, 2020. Just an update. Over the past 2 weeks, obviously, I've been trying to advocate for hotel rooms to accommodate COVID-19 and suspected COVID-19 people so that they can be quarantined away from their families to prevent domestic infection. Unfortunately, that ship has sailed. We didn't learn the lessons from the Hubei province isolation mechanism, and so there seems to be a very large reservoir of asymptomatic and symptomatic COVID people who are at home. I have somebody who I know very well who is in hospital together with his wife and his brother, all living in the same house. So we have to move on to the next step, and the next step is to try and help the people who are at the front line of this. What is becoming obvious is that healthcare workers are in all forms, the doctors, nurses, nursing assistants, the respiratory therapists and environmental care providers are all suffering from some version of burnout. Not only are they fearful of infecting their families, but their families seem to be very worried about them coming home and infecting them. And every day they're in the hospital, there is some possibility of an environmental slip where they can be contaminated. So the next step of this phase is to try and offer respite for healthcare workers who feel like they need a timeout and to get into a safe, quarantined environment where they can take a shower and not affect their families. I started a fund yesterday for my particular hospital, which we called the staff hotel fund, and very quickly raised $30,000 thanks to a couple of calls put out to some of my close friends who were most generous and very, very rapid in their response. So there's obviously an enormous groundswell for this. I am now meeting with our foundation to try and operationalize this, because putting a person in a hotel for 14 days, even if the hotel cuts you enormous discounts, amounts to about $100 per day per person. So it's very expensive. We are obviously also looking at converting university dormitories. This was a plan where the state university dormitories would be converted to hospital beds. It may be better to repurpose them as quarantine facilities for healthcare workers. So whatever it takes. The important thing is that this really needs to happen around the country, because we in New York, obviously I'm on Long Island, were hit really hard with this sucker punch of everybody coming into the country from overseas, New York being the first port of call and very rapidly disseminating. We're still seeing terrible increases in numbers, and it's a horrible sight. So let's try and help our healthcare workers. I'm doing something as best I can in my environment, in my hospital. I think that around the country, those places who have not yet been hit, the first step is isolate any PUIs, that's people or patients under investigation, away from their families if possible and as soon as possible. And if you cannot help that community subset, then help the healthcare workers. More to follow. Thanks a lot.